Hey guys, and welcome back to my channel. So in this video we'll be speaking about the things you should never do in a hospital. If you didn't see last week's video, I'll suggest you go check it out. I spoke about all the things that you need to pack for your hospital overnight stay. So whether you're visiting a loved one in the hospital or you are the sick person in the hospital, here's a few things that you should never do to keep yourself safe and the healthcare workers that are going to be working with you. So when you're visiting someone who has been hospitalized, please make sure that when you do visit, you are visiting within the visiting hours prescribed by that ward or by that hospital. Or if you're going to be visiting outside of the visiting hours, please make sure that you get permission. Because the reason why we have visiting hours is obviously we can't have people coming in and out of the ward, but also it helps us as the health professionals to make sure that we're getting our work completed, so that when you guys do visit, we are not in your face, we're not trying to do any medical interventions while the family is visiting, because we want to give you that space. As a result, please also respect us as the healthcare professionals, because you will notice that in most hospitals, if they have a morning visiting hour, it will be after 11, because that is usually the time that is after our morning medication round. And also most of the doctors visit the patients early in the morning, usually before 11, or if they come in the afternoon, they usually come after 1. As a result, that's why we badge our visiting hours, to make sure that we have enough time to do the medical interventions that we have to do, carry the doctor's orders, and also to make sure that the doctors have done their rounds, so that when you guys do visit, we have done majority of our work, and also we will have better questions or better answers for you when you guys do visit, because I know most people when they visit, they want to know what the doctors say, what is the plan with the doctor, and that sort of thing. As visitors, please make sure that you're following the hygiene rules of the hospital, because you as the visitors can bring bugs, can bring illnesses to the patients that you're visiting. Or on the other hand, you touch things in the hospital, the beds, the railings, and that sort of thing, and you can actually catch things in the hospital. So please make sure before you enter the room where the patient is, disinfect your hands or wash your hands, and before you leave, wash your hands or disinfect your hands with the hand sanitizers. The other thing is, before you enter a private room, which means that the patient is most probably isolated, please read carefully the sign that is on the board. Usually there's a red sign if the patient is on airborne precautions. So that's anything that they can spread through talking, breathing, and that sort of thing. The most common one that we know is COVID-19. As a result, you need a mask before you visit that patient. The other thing is, you can see a green sign that says droplet precautions. That means that patient, from their coughing, their saliva when they are talking, or anything that they've coughed on, which is the railings, the bedding, can have the infection that they have, and you guys can catch it on by touching. As a result, you would need a mask and gloves and an apron before you visit that room. Or if you see a yellow sign, it means that person is on contact precautions. So that means that either there's something in their blood, or usually patients that have got diarrhea or skin infections, those things you can catch on by touching. As a result, you'll need gloves and an apron. So as a result, before you enter any private room, please ask the nursing staff or read the signs on the door to make sure that you're having the right protective personal equipment before you enter that room. Because as much as we can tell you guys that no, don't do this, you must have this PPE, I know sometimes there is family members that are stubborn, because I understand in their mind their justification is, this person was with us at home before they found out that they had this bug or they had this infection, and none of you caught it. And I understand that, but the reason why they're now being isolated is we want to prevent further infection or further spreading of that infection. As a result, please make sure that you're putting on the appropriate personal protective equipment before you enter any isolated room. The third thing for our visitors is, if you guys are going to come in a big group, please make sure that you're keeping your noise levels to a minimum. I know you guys get excited, you're laughing, you're trying to make a family member feel better, but in some cases you guys end up disrupting everyone else around you. Also, when you guys are a lot, you take up a lot more space, and sometimes you inconvenience other patients around your specific patient that you're visiting. As a result, we usually say 2 visitors per patient. So if you guys are a big group, you can take turns. 2 people go in for 15 minutes, you come out, and the next batch goes in. Just also, it will help you guys with infection control, so that all of you will make sure you get time to disinfect your hands, wash your hands, and you get that personal visiting time that you need with your person without disrupting everyone else. Please do not take pictures without permission. And I've seen a lot of family members wanting to take pictures of the patient's files and that sort of thing. It is illegal to be taking pictures of your patient's documentation because you are not the patient. The patient can refuse for you to see that documentation. It is their private property, so please do not do that. The other thing is, do not take pictures of your person that you're visiting in the hospital, because I've seen many accidents where they take pictures and in the background of that picture there's other patients in that picture, or there's other identifying documentation or other identifying features like your hospital number, the type of hospital that they're in, and that sort of thing within the background picture. And as a result, if you post those things, or even if you keep it in your phone and there's other patients in the background, you're violating that patient's privacy. If you as the patient bring your own medication from home and your doctor prescribes that medication for you to continue taking it while in the hospital, please make sure that you do not take your own medication without notifying the nurse who's going to be giving you the medication on that day. Because we want to avoid double dosing you, meaning you take a certain medication, then your nurse comes and gives you the same medication and you can actually overdose. The other thing we want to avoid is for you to take a certain medication that has a drug interaction with another medication we're going to give you, because also that will cause a bad reaction for you as the patient. So please make sure that if you're going to be taking any of your own chronic medication by yourself, that you also notify the nurse what exactly you are taking. And also, don't take the medication if you don't know what the name is, because you might take it like, oh, it's just a medication I take every day, and then you don't know the name. Now as a nurse, I will not be able to know if that medication will interact with anything else that I'm going to be giving you. So when you're admitted, that's why I spoke in my video last week, when you're admitted, please have a written copy of the medications that you're taking, but also the physical copy, so that we can make sure that your doctor re-prescribe it for you, so that we can give it to you in the hospital, so that we're keeping track of exactly what you're taking in the hospital. It is to protect you. Do not ignore the dietary restrictions that we put on you as a patient. In most cases, most patients will either be NPO, meaning nil per os, or nil per mouth, meaning you can't have anything to eat and drink. The other one, we can put you on a clear fluid diet, meaning that you can only have foods such as jellies, soups, and that sort of thing. Nothing that is going to have a lot of substance and it's going to stay in your tummy for extended periods of time. Also, your doctor can put you on a specific diet. It can either be a renal diet, a diabetic diet. All of those diets are tailored to you based on your medical condition. Most cases, a nil per mouth order is to make sure that you don't eat or drink anything either before a scan or before you go to theater, because we want to prevent you from aspirating while you're under anesthetic, or the scan that you need to have, it needs to be able to visualize everything that is happening in your abdomen. You must never take a sleeping tablet after 1 a.m. And the reason for this is, one, you're going to have difficulty being awake during the day if you take it late. Number two, the reason is it also affects your ability to function the following morning, because in most cases some patients have to be seen by a physio, they have to go for a walk, we need to manage their pain, the doctor needs to see them. So if you're not fully awake during the day, we can't make an accurate assessment of what exactly is the progress of your illness, because there's been cases where the doctor will come and the patient is really sleepy because they took their sleeping tablet late, and the doctor assumes that you are sleepy because you're taking too much pain medication. As a result, the doctor decreases the amount of pain medication that you're taking, and now we can't manage your pain because it's been decreased because you were sleepy when the doctor was there and they were not able to make an appropriate assessment. Never insist that a doctor does a job that a nurse does. And in most cases, this has to do with drawing blood or putting up an IV line. No shade to doctors, but in most cases, us as the nurses, we are the ones putting up majority of the jobs, especially in the private sector. As a result, we have more practice with it. I understand that your doctors are trained in that sort of thing, but it would be highly advantageous for you to trust someone who does it more frequently than someone who does it once in a while. Their technique is not always great, and also it's just ultimately disrespectful towards your nurse. We have trained for this, we've put in the hours of practice to making sure that we can do the skill that the doctor has asked us to. And also, your doctor has entrusted us to be able to follow those orders. Just give us that trust and allow us to do the job that we expected to do. Because trust me, your doctor would do their job, so allow us to also do our job. Never tell a nurse to have a nice, quiet shift. We hate the word quiet. There's just something superstitious about that word. It just sends a shiver down our spine. Even if someone says it accidentally in our premise, we tell them to take it back, or to touch wood or whatever, to take back the curse that that word just brings. Anyone who's ever been told have a nice quiet shift, they will always end up having to resuscitate someone, having a busy day, having a lot of admissions. A lot of things just goes wrong. Like we say with Murphy's Law, anything that will go wrong will go wrong. As a result, please do not tell us to have a quiet shift. Just tell us have a good shift and you keep it there. I understand for you guys it's a nice sentiment. You want us to have a relaxed day, because in most cases we are running around, we're so busy, it's chaotic. But that word, we don't want to hear it. So touch wood. Never rush your discharge process. I know when the doctor comes and tells you you are ready to go home, in most cases we are all very excited to go home. However, this usually leads to you guys as the patients rushing the whole process and not receiving enough information that you need after your discharge process. Because while you're in hospital, everything is being done for you by the nurses. We know when to give you medication, when your wound must be changed, what diet you're supposed to be on, and that sort of thing. And once you're discharged, all of a sudden that responsibility is now placed on you. As a result, please give us enough time to be able to discuss with you what are the orders that you need to follow through when you go home. When are you supposed to be taking your medication? What medication are you going home with? Where to fetch that medication? If you have a wound, you have a catheter that you're going home with, or any other device that you're going home with, when must it be changed? When is the next follow-up appointment? There's a lot of things that we need to discuss with you before you go home. So please make sure that you are giving us that opportunity to give you that health education before you go home. If you're someone who forgets easily, usually hospitals will have a health pamphlet that they can give you that you can follow when you go home. So please take the time to read it and take it at home. Or if you're still a bit drowsy from the medication, allow your family members to come a few minutes ahead of time. Then we can have the whole health education discussion in front of your family member that is going to be taking care of you at home, so that at least we have two people listening to the health education, because that will improve your outcomes at home, because you know what danger signs to look out for, where you should go when you experience those danger signs. If you see anything abnormal in your condition when you go home, you will know what to do. So as a result, please just give us the opportunity to give you the discharge information that you need without wanting to rush out the door. And the last one that you should not do is, please do not smoke the day before or a few days after your operation. And I know it's extremely difficult for patients that smoke on a regular basis, but the reason why we recommend that the patients do not smoke before going for an operation is smoking before surgery poses a significant risk to both the procedure and the patient's recovery. It reduces oxygen delivery due to carbon monoxide. It complicates anesthesia management, it delays wound healing, and increases infection risk. Smokers are more likely to experience post-surgical complications, require longer hospital stays, suffer from impaired lung functioning. So quitting smoking before surgery is strongly advised to improve outcomes by enhancing oxygenation, reducing complications, and promoting your overall recovery. So as much as I know it's really hard to let go of that habits that you've been having for a really long time before you came for this operation, just for the time period where you are going for your operation and just after, for your own safety and to improve your outcomes, please just refrain from smoking. If you can't stop, at least decrease the frequency. So these are all the tips that I can give you guys if you're going to be visiting someone or if you're going to be a patient, of the things you should never do when you come to your hospital setup. So in next week's video, I'll be speaking about the things that us as healthcare professionals we should be doing to manage the stress that we undergo when we are treating our patients. I'll be speaking a lot about compassion fatigue and decision exhaustion that we go through as healthcare workers. So until next week Friday, 12 p.m. South African time, have an awesome one. Bye guys.